Welcome, everybody. I'm Warren Escadal. I'm the Chief Exec of Voluntary Sector Northwest, and I'm working with Jan, Bruce, and Christine, who are colleagues in the Northwest Thriving Communities Network. Can everybody see the slide just before I carry on? And people can nod. Fab, right?
Yeah.
So welcome, everybody. We've got big numbers here, so we won't be able to do chats here, but the timetable for today is me for about 20 minutes, and then we'll try and do the best part of an hour in workshops where you get to talk to people who will be part of the program, who will be in your patch, as it were, and then we'll do a 10-minute roundup and finish at 4:30 at the latest, if that's okay. So welcome, everybody, and to the first launch event for the Northwest Thriving Communities Network. So I've got lots of slides and I'm not planning to go through all of them, but I've put quite a few in there just for information, just to give you a sense of where we're up to and a summary of stuff. We're recording the webinar, so if you don't want to, you shouldn't be seen, I don't think, given there's how many, but bear that in mind when we get to the workshops. If you don't want to be recorded in the workshops, we're just doing it mostly for our own notes, but it may be that if there's some really good examples of practice going on, that we'd take a clip from it and promote that. But if you're not happy, please let the person from the network in your room know. Sorry. That's a good start, isn't it? Choking to death. Right. So please use the chat box to do any questions, and we'll try to answer in there. We've put on a couple of Twitter names. There's the NASP tweets, so that's the National Academy for Social Prescribing tweets, and then we've got VS&W's one on there as well. If you are tweeting, please use the hashtag Thriving Communities, and we can pull together and hopefully build on that conversation there. And I'll try and not die before the next 20 minutes are over. Right, so you should see in front of you the Northwest. Now, it's a weird version of the Northwest for this programme. So it covers the NHS's vision of what the Northwest is. So we've got Christine Blythe, who is the Northwest Regional Coordinator. She's the Chief Exec of Burnley, Pendle and Rossendale CVS. And if you have a look on the bottom middle slide, part of that diagram, you can see that Christine not only is the regional lead for the Northwest, but is also the Lancashire and South Cumbria. So this is part of the point about I'm making around the NHS footprints. So if you are part of North Cumbria, you are covered by the Northeastern Yorkshire regional coordinators. It's not a problem to us. We're happy to have North Cumbria people sign up to our mailing lists. But if you want to be involved in some of the conversations around the investment coming out of the NHS part of this conversation and to sign up for some of those networks, you will need to make sure you get in touch with Jane Hartley, who's the regional coordinator working with Vaughan in the Northeast and Yorkshire and North Cumbria. So apologies for the bizarre nature of the geography of this. We currently run the Northwest Social Prescribing Network, where we're always open to new members. And what we're trying to do as part of this is develop a particular VCSE social prescribing network that covers the footprint. I'll try and you should meet Christine later on as part of the workshop session. So she'll be running the session on Lancashire and South Cumbria. Jan Campbell, Sefton CVS, she is running the Cheshire and Merseyside part of this programme, and you'll be able to meet Jan if you are attending the Cheshire and Merseyside. So again, it's Cheshire and Merseyside because of the NHS footprint. And in Greater Manchester, you should be able to meet Bruce Poole, who's Salford CVS and has been endorsed by the 10GM network. So when we put together the proposal to split the Northwest voluntary sector in thriving communities, we were very conscious of making sure we had endorsement and that we were a far-reaching network that would connect into grassroots social prescribing from a VCSE perspective at the very least. I've put the logos on there of each of the regional partnerships that are endorsing this approach. As part of our vision, this isn't the Thriving Communities one, but why we wanted to come together in the Northwest, very much that emphasis on voluntary and community social enterprise sector. We outlined our own vision of why we wanted to come together. So it's an all sector, VCSE led, collaborative approach to holistic social prescribing. So this is, yes, link workers, but link workers plus, and being conscious of the role of grassroots groups and others in supporting effective social prescribing. So it's not just about people who refer on, but it's about the organisations that will take referrals as well. And I think that's the emphasis that we're trying to make, and NASP, the National Association, the National Academy of Social Prescribing, are trying to make as well. I've put on the vision of the National Academy. So it's very much, this part of it is very much about supporting the VCSE sector. So I think when NHS England were initially rolling out the programme of link workers, we were conscious that it was a bit hit and miss. A lot of the time we've got involved despite things, but an effective social prescribing model needs to link to voluntary and community and social enterprise sector groups. So that's the emphasis we're trying to add to all the things that are going on in the social prescribing world at this current time. So thriving communities, it champions the work of the sector, as I've mentioned, and the aim of this programme is to share learning, gain new ideas, access funding where possible, and develop new partnerships across sectors. So the regional team, which I've outlined, and you'll get to meet your local person, is supported by a network of national agencies who are all keen to support the sector to provide effective social prescribing. So those agencies there, so Sport England, Debt Advice Services, Natural England, NHS Charities Together, which is the charities of hospital trusts, Arts Council England, and NHS England and Improvement. So it's a big partnership, all focused on supporting the sector. So there's three main parts at this point in time. So this is the first year of the National Academy and the first year of the Thriving Communities programme. So the four strands, which I'll give a bit more detail on, are the Thriving Communities Network, Learning Together Regional Support Programme, Thriving Communities Fund, and I'll say, and the NHS Charities Together, thinking about how they support groups. So I'll run through those. That's the point of my presentation here. So the Thriving Communities Network. So presumably you've all had emails. You may have joined. If you haven't already, please email this email address and you'll come through to Martin Hall and Christine, who will sign you up to our mailing lists, and we'll keep you in touch with what's going on in the Northwest and nationally. There's an online learning hub or ideas hub with examples of good practice and ideas. If you're doing something amazing about social prescribing, please submit your examples of what you're doing to that and let other people know, and promote yourself. Make sure you promote yourself. If you want to sign up for the national webinar series, there was one on Monday, which was focused on the NHS charities and the previous fund I mentioned, which was the Thriving Communities Fund, Partnership Fund. Then you'd sign up for the webinar series there. We are endeavouring to get hold of the video of Monday's event, which will give more details than I'm providing today. So if you want to know more and hear directly from NHS charities and from the Arts Council around those funds that they've put forward, then we'll circulate this as part of the follow-up to this event. Right. So this is the first of the four. So it's the three other areas I was outlining. The Learning Together programme. So it's very much around supporting the sector, and we're looking to support small groups, hopefully across each of the geographies. So Cheshire and Merseyside, Greater Manchester, and Lancashire and South Cumbria, and possibly Northwest. So we're looking to support action learning sets around those areas. What we'd like to do is theme those around certain issues. So one we were thinking about, but it's up to you if you want to apply for it, would be around, say, the sector's role in mental health and social prescribing. It's got a link to social prescribing, obviously, but one we were thinking around was around mental health and making it specific and getting the learning out that the sector needs in order to support that kind of model of social prescribing referral. The application form, I've put the link on there. The deadline is noon, the 11th of December. So not millions of miles away now. It's flown by this year in one way or another. But if you're interested in coming together and working with each of us on a more focused long-term basis, it's roughly a 6-month programme, but hopefully it'll be something that really informs the practice that you're using and working on as part of your own social prescribing network locally. So, Thriving Communities Fund. I know you want to hear about all the money that's going to be available through the National Academy. And what they've done is they've found two key ways at this point in order to support the sector as best possible. They have massive demands on them, these two programs. They're both national. They've got to cover a lot of ground, and there won't be massive amounts of funding. This is the first one, and hopefully there'll be more following on from the National Academy as they start some of the conversations with NHS England and other partners that I mentioned before. So the first part of it is it's a 12-month programme. It's 1.4 million, so it's not massive. It's a mix of NASP and Arts Council lottery funding. It's for grants of 50k maximum, but there is a catch around needing 20% cash match, and that looks like a genuine cash match necessary. Lots of codicils around this fund, but please do talk in the workshops in your area around what we might be able to do. So it's not massive. The 7 NHS England regions, so that would be the Northwest. So we'd be looking to support at least one or more bids from each of those geographies within the Northwest. So it's with wider partners who are listed there. It's about bringing together a place-based partnership to strengthen local infrastructure for social prescribing. It's community level activities. It's not a big amount of funding, as I've mentioned, maximum 50k for 12 months work. It's a partnership approach, so 20% cash match and a partnership approach. Every project must deliver across all of these sectors listed. So it's culture, sport, natural environment, health, and the wider VCSE sector. So there's lots of requirements and ifs and buts connected to the partnership you need to build. Lead applicants should be VCSE groups, and minimum 3 core partners at application stage, and one of them has to be a cultural or arts organisation, given that the funding's coming with match from the Arts Council. There's the list of partners that you need to be thinking about: arts and culture, sport, finance, wellbeing, environment, and then health and care organisations. Timeline: it's been launched. The applications portal opened on Monday. The deadline is the 8th of January, and applicants will be notified by the 8th of March. The link to the portal is on the bottom of that slide there, Grantium, and we've just been given the warning that it could take up to 5 days. Hopefully not, but just in case, don't leave it to the last day like I probably would. And that's the main link. All right, so that's Fund 1. The other fund is the NHS Charities Community Partnership Grants Programme. So this, at the moment, is in development. And what we're doing is working on each of those funds. So there'll be 3 in the Northwest, plus Cumbria, Northern Cumbria. Sorry, just slide on. So it's part of the larger grants fund. So the money for this was raised in Lancashire, much of it through Major Tom, supporting NHS charities. So as part of that funding, £30 million was allocated to a community partnership grant. So the way it's working is they are asking initially, so this is before we get involved as a sector, they're asking for one NHS charity from each of the areas. So one from Cheshire and Merseyside, one from Greater Manchester, and one from Lancashire and South Cumbria to put in an expression of interest and draw down that investment, and then think about how it shapes that investment in order to develop those partnerships with the sector. So there won't be massive. We've got 3 big geographies in the Northwest, so they're roughly about £1 million plus. But if you go through the geography and the maths of all this, it's not massive amounts of funding again. So the one I've been working on with Jan is the Cheshire and Merseyside one. So there's 9 local authority CCG areas, and the fund there is 1.3 million. And we're talking to Alder Hey Hospital Trust, Charities Trust, because they're the only charity, NHS charity, that covers Cheshire and Merseyside, about drawing down that investment. So they're being asked to put together their applications and draw down that investment up till the end of March. So it might not be around before Christmas. And then what we're doing is trying to shape what that investment looks like and how it may work with the wider voluntary and community sector and give us the best bang for buck for that funding. This is the slide from the NHS charities. So I think the thing to take away here is there's been a lot of talk about this NHS Charities Together community partnership programme, but at this point, the NHS charities in each of those areas are drawing the cash down, and we are talking to them with a view to rolling it out to groups. So we've got no details on a programme or an application process or even how that funding is going to be used. If you go on the NHS Charities Together website, I've not got a link on here, but we'll add one, but it very much looks at how the sector might work with acute trusts. So it's very much around patient discharge and prevention and some equalities work. So for my mind, it's a good opportunity, but it's a little bit far away at this point in time from what we might envisage as investment for social prescribing, but we will do our utmost to make that happen. But if you want to find out a little bit more about where we've got up to with that, you should be able to do so with the relevant person from your geography in the workshop sessions. Right, so if you want to sign up for the national thing, I've put the links on there and you should be able to see that. So I'll unshare this. And the best part of this is, I'm sure you've got lots of questions, but you won't be able to ask me them, but you'll be able to ask your person from your workshop who works in your area. So hopefully we should go into the workshop sessions and begin to talk about what the themes around that Learning Together programme might look like, what we as a sector might need to happen in order to support us get involved in social prescribing, what we would like some of that investment around the NHS charities funding to look like, and find out whether you're interested in pulling together a partnership around the Thriving Communities Fund. So this is where I can just say anything I like now. So we're going to try and put you into your workshop rooms based on what you put into the website when you join the webinar. And if you're unhappy with which room you're in, then just send a message through the chat box to me or Anna Cooper. Anna's probably better, and she will relocate you to your new chosen region of preference. Right, so can we start chucking people into rooms to meet humans that they can talk to? Do we want to do feedback from each of the workshops? Do we want to do that next? We had a really good one. Who should we pick on first? Should we go Bruce?
Did you spot I had my head down, was typing into the chat? So we had an interesting breakout room. I think, you know, we're very clear that there's not a lot of money to go a long, long way. We've just discussed very briefly in the last 20 seconds of the workshop, the opportunity to come together and have a further workshop to explore where we go with this. I think that wasn't long enough, and certainly to invite interested partners to come back with friends, partners, additional organisations that may have an interest in applying for a cultural arts-based programme. We talked very loosely about a small grant scheme. We didn't think that was manageable on the scale, and I think that was the general consensus. If there's any detractors from that, please speak up. Yeah, I just think we found it quite difficult to focus down on an area for a partnership bid at this stage, but I'm sure there's an appetite in the room to explore this further.
Thank you, Bruce. Does anybody want to add anything from the Greater Manchester Group? We'll only go one person, but if you want to stick your hand up in the participants, I'll go for whoever gets there first in a really undemocratic and inclusive way. It's winner takes all capitalism on Zoom. Anybody from Greater Manchester? Is that a message? Otherwise, we will go to Jan from Cheshire and Merseyside.
Hi, it's a good conversation. I think we particularly got a lot around the Learning Together opportunity, and I think the number of things that came up about one of the things being about parity of esteem in terms of recognition of our relationship with the health system, and about how do we develop a better understanding of the health system, but equally how do we encourage that recognition of equity, and in terms of people working in the health system seeing us as equal partners rather than as an addition to the system. We are part of it. So possibilities for exploring that as part of Learning Together. Also the opportunities through Learning Together of bringing in some of the expertise around arts and culture, bringing in experts around sports and leisure, and sharing that across organisations. So we had somebody who works in a mental health organisation talking about wanting to maybe share their expertise, but also learn from other people's expertise. We talked a bit about the fact that the money here is not really a great amount of money, and that there's a big ask in terms of the amount of money that's available, and how that's also in some occasions replicated in some of the offers that come through the health service, so that we're not being covered for all of our costs, or that the offers, it sounds good on paper, but when you try and implement it, it's not possible because they're not looking at all of the elements that need to be included. So looking at ways that we can maybe rectify that by better sharing of information and understanding of each other's constraints. In terms of the Thriving Communities Grant Fund, we didn't really get to anybody saying that they particularly were going to go for this, but I think what we're asking people to do is, if they're working on the Merseyside Cheshire footprint, if they are thinking about going for it, to contact myself as the local lead, so that we've got an understanding of who's there, to see if we can broker some of the support for people out there, so bring people together. And that was, I think, sort of a very quick summary of where we are. And I think, again, we will meet again to talk further. Does that sort of summarise it? Warren, do you want to say any more? Does anybody else want to say?
I'm going to use some of the insight from that workshop in my closing remarks, because I thought it was a really good discussion. No one was fooled by any of these opportunities to bid for very little money, but were very spot on strategically, I think, was mine. Is there a hands first in the participants list? Anybody who wants to chip in from the Cheshire Merseyside group? Are you all shy? I don't think you are, but anyway. Right, we'll go to Christine, Lancashire and South Cumbria.
Yeah, thanks, Warren. Absolutely fantastic workshop, I have to say. It was, everybody was really contributing. We did get some ideas about what sort of things were worrying people. Green social prescribing came up, things about trauma, things about supporting women in general, stuff around supporting men and some of the difficulties that men were having. Lots around sports partnerships and the benefits of health and physical activity. Again, we got some offers of support, not around, around cash matches, that sort of thing. So it was absolutely fascinating discussion. A lot of encouragement for the whole social prescribing network around how good it was to have something to be able to share ideas and to help grow the profile of social prescribing. So a lot of interest in being involved in the network from Lancashire and South Cumbria. So a lot of discussion, a lot of interest to remain involved with it all, which I thought was absolutely fantastic. We do have one or two ideas. We talked about how we can influence some of the stuff around NHS charities to hopefully get some of that funding down to the small voluntary sector organisations. So all in all, a really positive workshop. And as the others have said, it's something that we want to follow through. So we will be sharing contact details. We will be keeping the communication methods open and meeting again to try and develop that. So I know there were one or two people who couldn't join today who have expressed interest as well. So hopefully we can start to grow our own within our RCP area and develop it further. But a very positive start. So some real interest and some really good ideas going forward, I think. Anybody from Lancashire South Cumbria want to add anything?
No, lovely. Thank you very much, Christine. That was really good. If you've seen the chat, is that Greater Manchester, Bruce, the offer you've put in the chat, or is it Manchester, Greater Manchester? So an offer there for a piece of work with GMCVO and the LGBT Foundation as well. So that's fantastic. I think the thing that stood out for me today was not necessarily it came from our workshop. It's nice to hear other parts of the other workshops are coming up with clear proposals. I think the message for me was there was an interest in the commitment to supporting the VCSE sector and its role in social prescribing. And there was a clear message asking us as a network to think through how we lobby for effective investments in the VCSE system, the locality working, and get the social prescribing investment right. So we've seen, I was trying to work out how much investment has gone into link workers so far. I don't think it's massive, but it's much more substantial than what we're seeing at this point around here. So it'd be nice to see that kind of parity of esteem, as Jan said, where we work side by side with the NHS and we're recognised in that way. It was a lovely phrase from our workshop around how do we get that quality assurance of social prescribing right without losing the pixie dust of what works well for communities, which I thought was lovely. A couple of themes in terms of what we might do on the learning together piece, those action learning sets, was around mental health, but also how you might work with culture and arts organisations and physical activity. And I thought that might be really useful, that kind of work, because we could plug in the Northwest regional equivalents of, say, the culture and arts piece, or the Active Lancashire support for Northwest sports partnership involvement in this programme. So I think there's opportunities for thinking through how we pilot and, as colleagues said in our workshop, make the business case for the sector, both to GPs and the NHS system wider. So I was thinking, because I have a role on the Health and Social Care Partnership for Cheshire and Merseyside, and I was thinking if we could get some projects in Cheshire and or Merseyside going, then we could plug them in as pilots to see how they can inform those conversations. So I think they were the things that really stood out for me. Is there anything you want to add in there, Christine?
No, I think you've just said it all, Warren. Thank you. I've done enough talking, I think.
Yeah. Thank you
but
very
I think
much.
we've just had a fantastic attendance at very short notice, really. This whole programme has been really quick. It's moving at a tremendous pace, I think. As I said, in our workshop, from our interview at the end of October, we were literally told, yeah, you've got the job, get started. And it was that quick. And then the launch was literally within a fortnight of that. You know, a fortnight later, we're here today. So I think it's just a really, really quick turnaround and a really quick movement that we've got to keep going. So thank you for everybody.
Lovely. Is there anything anybody else wants to add? Otherwise, we'll wrap up there. Make sure you sign up to the mailing lists, and we'll be back in touch with more news and events in order to support you. And don't forget to do the application processes, particularly the learning together piece. And if you can get bids in for the Thriving Communities Fund, that'd be good. We'll let you know how we're getting on with the NHS charities in each part of the Northwest. All right, we'll finish a bit early, which I think is always an advantage in these days of lots of Zooms. Thank you to everybody who came. It's been fantastic to meet all of you. If your workshop was as good as ours, then it was, for me, it was really good conversation. It was nice to be able to listen in. And we will catch up with all of you very soon in the future. All right, we'll see you all soon.